the U.S. surpassed 12 million cases of COVID-19 on Saturday. It followed 2 straight days of record-breaking highs that drove the United States to 1 million new cases in the last week. On Thursday, the CDC recommended against traveling and gathering for Thanksgiving, but the TSA says it processed more than 2 million passengers on Friday and Saturday, the highest 2-day total since mid-March. Here's the headline on the front page of this morning's Washington Post. Testing negative to travel home. About the safety precautions students are taking to protect their families. And when it comes to hospitalizations, Dr. Anthony Fauci said yesterday that a substantial portion of those in the hospital are middle-aged adults between 40 and 59 years old. A lot to get to with our experts. Joining us now, Dr. Vin Gupta. He's a pulmonologist and an NBC News medical contributor. Also with us, Morning Joe Chief Medical Correspondent, Dr. Dave Campbell. I think we start with the bad news that we're seeing, especially as we're heading into Thanksgiving weekend. I mean, Dr. Gupta, and I'll also get to Dr. Dave on this, but a lot of kids are coming home for the holidays. Some of them are planning to stay home probably through the bulk of the holidays, but that travel is taking a huge uptick. Can that impact even more cases happening?
Good morning, Mika. Absolutely. If you're a college student, I'm just going to get straight to advice here. If you're a college student, shelter in place for at least 7 days once you arrive and you're with your loved ones, at least 7 days. Testing is constrained across the country right now, so you can't test your way out of or into safety here. You just have to mask up when you're home, try to quarantine for at least that 7-day window, and try to get that lab-based PCR test through a drive-through at that point, so you can give yourself and your family members a sense of relief. For everybody else who's just traveling for a few days for Thanksgiving, cancel your plans. Cannot be more clear here. There's been a lot of shades of gray here, a lot of uncertainty in the signs of COVID-19. In this case, cancel your plans. Over the weekend, I can't tell you how many calls I received, Mika, from friends of friends who have loved ones in the ICU, anywhere from 20 to 80 years of age. I've heard in Texas, they're rationing plasma. I've heard this from a close source there. I've heard that pulmonologists, critical care docs are the rate limiting step now to getting life-saving care. This is now the big issue. We are in a 5-alarm fire. You should not be traveling. There's time to cancel your plans. There is no off-ramp here. There is no ICU bed that's going to be staffed here reliably so throughout the country. This is a reality right now. This is not some existential reality. Cancel your plans if you absolutely do not need to travel somewhere.
And so, Dr. Dave, I'd like to actually emphasize the same advice, because if you're having a group of 12 or more, whether or not they're traveling or not, that's 12 or more people who've made a number of decisions based on their own personal safety. And in terms of advice for the holiday, I mean, a lot of people don't have space to quarantine for 5 to 7 days. Is it worth making the trip?
No. Dr. Gupta nailed it. And what's important to remember is this is a numbers game. The more people you're around, the closer you are to them, the more likely one of them will spread the virus to others. And there's no magical cure. We know that from the information you spoke about earlier with prevention and treatment options that are coming every day. But you have to prevent the disease in the first place, and what we have available today to do that, and through the Thanksgiving holiday to do that, is to limit the spread of this virus from one person to another. And what a horrible legacy of a Thanksgiving if you gather, whether you're even within your immediate family, and somebody gets sick a few days or a week or two later, and you can clearly look back and see that all you needed to do was either cancel the vacation, cancel the Thanksgiving, or limit the number of people, do it outside, and wear your mask. I think of all of the information and advice that we keep hearing over and over again, wearing a face mask while inside your own home around anybody else still makes sense, and it will continue to make sense all the way through the spring, through the summer, as we see the number of people presumably getting vaccinated increase, and as we see the number of therapeutics increase, from monoclonal antibodies to plasma to dexamethasone to whatever comes down the road next. But for the short term, Dr. Gupta nailed it. Cancel,
We're getting
cancel,
there.
cancel. And if you cannot or will not, limit, limit, limit.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.